On Social Plus Africa, we bring you highlights from Arise Train the Trainer workshop organized by African Research Innovative Initiative for Sickle Cell Education, Arise. The workshop was held in Abuja, Nigeria. I am Ene Iguvi. Enjoy.
We want to make sure that we can train laboratory scientists to be able to undertake the diagnostics, but also to be able to become people that can actually train and teach others. So that's why we call it Train the Trainer, because we have selected laboratory people that will work with them to help them in terms of the facilities and the whole procedure. And actually they're going to have a whole day today looking at various equipment. And actually we brought some trainers from the UK, we brought trainers from Ghana, because Ghana also do a program. So we want to make sure that all of these systems are in place so that people can be trained. I'm anticipating that the 6 laboratories that are participating would have people that are competent and continue to develop their kind of competency, but also they actually come to the UK or maybe go to Paris or go to Cyprus to do some further research studies. So we don't want it to only end as a training, be able to train others, but we want it to lead to further research and also service innovation, a bit of a transformation of services that is already ongoing in the country, but actually want to kind of build onto that. We are working with here, there are nurses, there are community extension workers, there are teachers as well. So we want to make sure that people, this will lead to awareness in schools, in nurseries, primary schools and secondary schools, but also awareness in the community. And we also will be developing radio jingles, which we'll actually use to try and raise awareness in terms of what is necessary in terms for somebody who is being diagnosed with sickle cell disease from birth. What do you do for them to keep them well? But actually, those who already have sickle cell disease and know that they have this condition, what is it that they can do to improve their life? For this to work, it is essential that government is at the forefront. And we have been working with states, we've been working with Kaduna State, we've been working with Niger State, we've been working also with Katsina State in the past, so that government actually own this, because it's only government that can make this work. It's government that can drive the initiative. Otherwise, if we do it, it's just going to be research, and we can't do that.
Arise is mobilizing to develop capacity, in managing sickle cell diseases in Nigeria. And the University of Abuja Teaching Hospital, universities across Nigeria, ABU, Ilorin, Kaduna State, all are coming together just to train individuals to ensure that resources are available, ideas are developed, local strategies are developed.
Sickle cell anemia is an inherited form of anemia, a condition in which there aren't enough healthy red blood cells to carry adequate oxygen throughout the body. How important is it for everybody to know their genotype? What healthy lifestyles should a sickle cell patient imbibe? Doctors advise.
If you have never had a child with sickle cell disease, you will not really appreciate how severe and how difficult the problem is. Because once you have a child with sickle cell disease and you know the pain they go through and you know the difficulties they go through, then you'll be able to actually understand their advice. So I can understand when young people, for example, decide to say, well, I'm in love, I don't care, but actually experience seems to speak much louder. Some of them is because of their siblings, some of them is because of families that they know, and that will actually help them to make that decision. So I can understand when somebody says, it doesn't matter, but actually the worst one is actually after people have had a child with sickle cell disease. Some of them tell you that they don't believe their child has sickle cell disease and they won't give you to the treatment, and that is more challenging. And some of them put religion or their faith and say, but actually your faith cannot change what your child has. So it's important that you give your child the best treatment. You also give them the best opportunity to have the best outcome in their life. Some people I've spoken to, because I deal with patients with sickle cell disease, and I've done that many years. So some parents who have children with sickle cell disease say to you, it's not really about, what has it got to do with love? Because they have experience bringing somebody whose daily experience is pain and challenges, and you don't know what else. What else is that some of the children actually begin to ask the parents and say, why are you so stupid that you didn't know to make your decision? So you don't want to live with the guilt. And so it's important to take your decision that you know why. If you know why, then you can make your informed decision. What we are doing is to make sure that the management of patients with sickle cell disease is optimum and will have the best outcome. So engagement with services is important. Engagement with doctors, and also coming to clinics, and you actually need to have a blood transfusion, you make sure you do that. So I think engagement, adherence to therapy is important, because you might give somebody treatment, if they don't take it, it won't work. And we now have some other interventions that are actually making life much better. We can now screen and know who has the risk of stroke, and we can give them treatment. One of the treatment could be blood transfusion, but because the difficulty of getting blood transfusion here, hydroxyurea is one of the drug treatment that we give to patients, and that improves their life outcome.
Well, since you call them survivors, obviously they have been doing something right up till now. But the main thing we actually say is, first of all, to make sure they are well hydrated all the time. Because when they are well hydrated, they are less likely to have crisis. So we have a lot of preventive care that we tell them to follow. Good hygiene, the basic things. And then for those who haven't been immunized, they need to take the routine immunization and special immunizations such as pneumococcus, some salmonella, which they are prone to. So that is also another one. Good nutrition, and they need psychological support as well, because some of them, when they've been ill for a while, they may feel discouraged and may need that psychological support and counseling. It's an inherited disease. In fact, it's the commonest serious inherited disease. You get it from your parents, so it has nothing to do with witchcraft or ogbanje. But why they say the children are ogbanje is because it happens in the same family. You know, they deliver a child, after 6 months, 7 months, the child dies, then they deliver another one, the child dies. So when they have the next one, they are going to say, oh, this one is going to die too. But that is because they never had early detection. You know, the diagnosis wasn't made early, because there's no doubt that with newborn screening, penicillin prophylaxis in the young children, and other new therapies coming up, many of them are doing very well now. They don't have to die. They can have healthy lives and do well. It's so important that we educate our children, even from secondary school level, to know their genotype. So it's not at the point when they have fallen in love and they are now fixed, they fixed a date for their wedding, you now tell them don't get married. Some of them will say they are still going to go ahead and get married because they love each other. But you also have to explain to them that that is not the end of it, because there are other options. When they are ready to get married and they decide to conceive, you can now have prenatal diagnosis, what we call prenatal diagnosis, because you can actually make the diagnosis before the baby is born, and you have a choice of what to do. You know, so we can have prenatal diagnosis, but more importantly, when the babies are born, we must have early diagnosis, because that will help in how the child will turn out. You know, so that's what we'll say. If you want to go ahead, we cannot stop you.
The past has been difficult, but the future is really bright. I mean, I've worked as a doctor for nearly 30 years, and 10 years ago, there were no clinical trials, or very few. The governments, even in the developing world, paid little attention, but there's now a whole array of interventions like newborn screening, access to care, increased funding for specialists, for nurses, but also importantly, new therapeutic interventions, new drugs. There are several trials that are running and being proposed, but also importantly, an increased access to cure of this disease, both bone marrow transplantation and, in the near future, what we describe as gene therapy. And this is, the momentum is absolutely enormous.
What is the goal, aim, Objectives. What does ARISE represent?
ARISE stands for the African Research and Innovative Initiative for Sickle Cell Education. The main objective of the project is to standardize the diagnosis and treatment of sickle cell disease in newborn children. It is a fantastic opportunity for professionals to develop and enhance their skills, to standardize to meet the objectives of the project.
A 3-day workshop was staged, and then we really like you to tell us what the workshop was aimed at achieving.
So the Train the Trainer workshop in Abuja was in fact one of the first workshops of the ARISE project which we've organized, and we believe it has been a tremendous success. The feedback we've received has been fantastic, especially with the laboratory scientists having had practical experience of going into a lab and having the experience of doing things, which we think has been a has been a success for this whole workshop.
So, what should we be expecting from ARISE in the nearest future? Are there other projects, something that ARISE is planning to, something interesting?
Oh, definitely. What you've seen with this workshop is just the tip of the iceberg. There is a lot to be done, loads of workshops and trainings to be scheduled, and lots of learning to be achieved. But yes, watch this space.
Did you enjoy everything about Nigeria?
Of course. I mean, since the day we've landed, we've had just nothing but such warm welcome, such kind thoughts, and it's just been amazing what we've experienced in this. I mean, to be honest, we hadn't had the chance to go outside and experience the actual culture and meet the people, but from what we've experienced with just being in these premises with the people around us, everything's just been so warm and so welcoming, so comforting. It's just been fantastic.
Okay, it's really a pleasure meeting you both.